In the famous story by Hans Christian Andersen, the ugly duckling goes on to become a beautiful swan. And that is how your transformation will take place. Only you have to be patient and compliant. So this is Dr. Bhatti. If you're new to my channel, I bring out frequent updates on evidence-based hair loss treatments and hair transplants, updates that you can rely upon. So if you haven't yet subscribed to my channel and you would like to get frequent updates, please subscribe. So the topic for the day is the ugly duckling phase in the aftermath of a hair transplant. Doctor, how will I look? Will I be able to go to the office? Will I be able to go to social events? I have a marriage to attend. Will I be able to look good? How much time will it take for everything to settle? Now, he's not talking about the result. He just wants a normal appearance as he had before the hair transplant. Now, he knows that the result will come only after 6 months to 9 months. But during that period, what should he expect and what will be his social and professional restriction? To keep you more informed about what to expect after hair transplant, that is the objective of this talk. Well, ugly duckling phase means different things to different people. To most people, it is the phase immediately after the hair transplant, which lasts about 2 weeks, when there is so much of crusting, when there are gaps visible at the back from where the grafts have been taken. This period lasts only for 2 weeks. In some people, especially those who are non-Caucasians, it may last 1 or 2 days longer, but it surely doesn't go beyond 15 days mark. So this is the time when most people cover their head with a cap or a bandana and it doesn't show. But then there are people who are in the front office and they do not have the luxury of wearing a bandana or a cap at their place of work. In such people, we advise them that they can use hair fiber after 2 weeks of the procedure. They can use Dermatch after 2 weeks as well, so that they look near normal. For the others who have the ability to wear a cap or the sanction at their place of work to cover their head with a cap or a bandana, that is not a problem at all. This phrase, ugly duckling, relates so well to the situation of the hair transplant patient immediately after the procedure. So the comparison is very appropriate. So once the crusts come off, the area looks clean. But if you are fair-skinned or if you're a Caucasian, there would be little redness over the planted area as well as in the donor area. The donor area is not a problem because once the hair come out, after 7th day or 10th day, it hides the reddish discoloration. But the scalp in the front, the recipient area, will continue to be little red, and more so if you go out in the sun without a head cover, it'll become red. Those people who are little sensitive to minoxidil will also have redness over the planted area. And then comes this phase of developing pimples. There's sometimes in the donor area, if there's an ingrown hair, there'll be a few odd pimples which will develop, which is the hair trying to grow out, the hair trying to break out and forming small pimples, which are not infective focuses, but at the same time, they cause concern to the patient. There are many people after the crusts have come off, they do not go into this ugly duckling phase. These patients are about 5% patients in which there is no shedding of hair, there is no shock loss, and the skin looks smooth, and the recovery is without any concern at all. Though these comprise a minority of patients, about 5%, but they only go to show that the healing process is innate to a specific person, to a specific individual. It is very difficult to predict how the phase after the hair transplant, till 3 months are over, will pan out, because everybody responds differently to surgical trauma. Whereas shedding is an acute episode, shock loss, which may happen, especially if we have gone in between visible thinning hair. This shock loss is a chronic phenomenon. So shock loss is a chronic shedding of hair, whereas the shedding of planted hair is an acute process. This chronic shedding, or what is referred to as shock loss, usually comes back. It takes up to 4 months, maximum 6 months for the hair which were thinning and which were traumatized during the procedure because hair transplant was done in between to come back. But there is a percentage of about 20% chance that these shocked hair may not return back. And this happens only if the plantation was done in high density in between thinning hair which were as it is on their way out, but their process of shedding has been hastened by the surgical trauma around them. Shock loss is minimized if the surgical technique is less traumatic, if it is minimal, if you follow the direction of the hair root, you stay parallel to the hair root of the thinning hair. You do not do very high density plantation around thinning hair. Now, what are the medical ways of avoiding shock loss? Medical ways of avoiding shock loss are to use DHT blockers starting 3 months before the procedure. However, this has a caveat attached to it. The caveat is that if you have miniaturization in the scalp donor, those miniaturized hair will look like anagen hair at the time of the transplant if they have been treated by DHT blockers. So that is not a good thing. These DHT blockers should only be given to patients who have been assessed to have donor areas which are lush and maximum hair, more than 95% of the visible hair are in the anagen phase. In these cases, to prevent shock loss, giving DHT blockers has no problem at all. So basically there are two ways to prevent shock loss. One is by stringent use of minimally invasive technique, and the second one is by medicines in selected clients. So the ugly duckling phase, that is the period soon after the hair transplant till about 3 months post-procedure, is just one of the parts of the continuum of the recovery phase, which comprises the healing process, the shedding process, growth of planted hair, regrowth of shocked hair, maturation of growth, and lastly, stabilization of the result. If you liked my video, please do not forget to subscribe. If you want to know more about the healing process, watch this video.